Hello, everyone, and welcome. This is Toni Parks coming at you again with the latest CDI topic. Today, and I'm thrilled to have you here, by the way. Today, I'd like to dive into how clinical documentation improvement can truly transform primary care. Let's chat about how CDI not only boosts patient outcomes, but also makes life easier for providers and keeps everything running smoothly. And by the end of our time together, I hope you'll walk away with some practical tips and fresh perspective that you can share with your team or your organization. So with that, let's go ahead and get started. Starting with accurate documentation. Accurate documentation is really the bedrock of CDI. It's not just about checking boxes, it's about painting a full, precise picture of the patient's health. This ensures that we capture all the complexities and nuances, which is crucial for accurate coding and appropriate risk adjustment. And when we get it right, it cuts down on those back and forth clarifications, queries, and makes everything run more smoothly for everyone involved. So ensuring reimbursement integrity is vital for the financial health of any practice. When our documentation is precise and comprehensive, it directly reduces claim denials and payment delays. And this means that providers are compensated fairly and promptly. A lot of rework doesn't need to be completed, and just overall helps keep the practice financially stable. So accurate documentation helps us to capture all billable services and maximizes revenue while minimizing revenue leakage. So ultimately, this creates a smoother, more efficient revenue cycle, which benefits not only the practice, but the patients we serve. So let me just stop for a second and say, it really helps the channel if you are getting any value from this content. I'd sure appreciate if you could like, share, subscribe, all that. It just really helps us out. And let's go to the next one. Okay, with that said, let's chat about compliance. It's not just about following rules, it's about creating a foundation of trust and integrity. So when our documentation is in line with regulatory standards, we minimize audit risks and potential penalties, making sure that we protect both our practice and our patients. And this approach ensures that we're not just compliant, but also delivering the best care possible. So working with us, we can help you find those little nuances, those little documentation deficiencies that could lead to a lack of compliance and put you at risk for clawbacks, just lower revenue reimbursement, and so on. So now when we talk about patient care, accurate documentation, of course, is at the heart of it all. It means that we're capturing every detail, ensuring that the care we provide is not just thorough, but also personalized. This attention to detail helps us to close the care gaps, the risk adjustment gaps, improve outcomes, and truly support our patients in their health journey. But when we think about supporting our providers as CDI specialists, what you have to understand, CDI is a game changer. It's really about giving providers the tools and knowledge that they need to document effectively, which in turn makes their jobs easier and the whole workflow smoother. So it's a collaboration that ultimately leads to better patient care and really a more efficient practice. Being audit ready is all about proactive documentation. Uh, CMS, OIG have really exponentially increased their audit capability with the intent of more regular, probably yearly audits. Um, so it's now more important than ever. By keeping our records precise and thorough, we minimize the risk of compliance issues and ensure that we're always prepared for any review that happens to come along. So this not only protects the practice, but also builds confidence in your processes and the quality of care provided. Then there's communication. Effective communicating is the glue that holds everything together, right? So how do we do that? Maybe continuity of care comes to mind. Transition of care documents are great, of course. They're a form of documentation that's very thorough and provides that continuity of care. But there are other more important ways for the primary care provider. Um, so CDI fosters a culture where providers and coders are on the same page. So the coders are capturing things appropriately for you. Um, and it also makes it easier to clarify and streamline your documentation. It gives that framework, that those guidelines to help understand that. So that's what we want to give you. That's what we want to share with you, is the tips, tricks, guidelines, rules, whatever advice or information we can give you to help with that process. And this collaboration can lead to more accurate records and ultimately really better patient outcomes. Looking at the bigger picture, CDI's impact on long-term outcomes is quite profound. By consistently maintaining accurate and detailed documentation, we can not only improve patient care, but also support the practice's growth and adaptability. Of course, once again, leading to better health outcomes, um, but also enhance patient satisfaction, which is part of our quality goals, and a more robust, value-driven practice. Okay, so as we, it's just really just an introduction to how a CDI professional, a CDI specialist can help you. That's what I want the takeaway to be from this. But as we wrap up, it should be clear that CDI is more than just a process. Um, it's really a commitment to excellence. So providers and CDI specialists have to be on board with that, wanting that uh, as close to perfection as possible and that excellence, and understanding that that leads to not only, excellent, better patient care, but also a highly successful business because, it is a business. So by embracing CDI, um, once again, we can enhance patient care and ensure accurate reimbursement, but also uphold compliance. It helps us, stay on the right side of things. So um, this holistic approach not only benefits patients, though, it also strengthens the practice, and the core really driver of revenue for the practice for the future. Okay, so now let's just open it up to you. I would really love to hear your questions and thoughts. So please leave your comments below. And Also, if you have any ideas of CDI topics, specifics you would like to know about, maybe you want to know how to document certain types of conditions, or uh, you want to know what the most common issues are, whatever it is, whatever kind of questions or concerns you have related to documentation. I'm curious. I'd like you to leave those in the comment. So just to help us have ideas for future videos that can be helpful to you. Your feedback is invaluable, and it'll help shape the content that we create. So let's keep that conversation going. And once again, I'd like to ask you to subscribe, share, like, and also if you click the bell, you'll get notified for future videos. Thank you for your time and attention today, and I look forward to hearing from you in the comments. See you on the next one.